I want to welcome all of you to Naugatuck Valley Community College and to thank you, Governor Lamont, for being here with us today. We're all aware of how the impacts of COVID-19 have hit certain populations harder than others, heightening disparities and showing in stark relief the systemic inequities in our society. So I find it especially fitting that you have chosen NVCC to announce your vision for using the American Rescue Plan funding for a transformative comeback for Connecticut, because as a community college, we too transform lives. Our workforce development programs lead to more than just jobs. They provide the foundation and skills that lead to careers and promotions. Our Advanced Manufacturing Machine Technology Certificate Program has flourished because of the state's continued investments. With over 40 certificates at NVCC, many of which are stackable in areas such as IT, manufacturing, and business, and programs whose advisory boards work closely with our Workforce Investment Board, we're an active partner with our communities and a linchpin to the state to assist displaced workers and strengthen our economy. So thank you, Governor Lamont, for your continued support and for recognizing the importance of getting our students back to in-person learning in safe ways. I would like now to introduce Will Hearns III, who is our Student Government Association Treasurer, who has a few words for you.
Good morning, ladies and gentlemen. It is my pleasure as the Student Government Association Treasurer to welcome everyone to the college during these challenging times. Naugatuck Valley College prides itself on its exceptional education and success. Naugatuck Valley has been a great college to attend. The past year has been interesting with many obstacles to overcome, and without the faculty, the staff, and the students coming together to overcome them, it wouldn't be possible to attend school. Let us all welcome with open arms our leader behind the fast action and educated calls over the past year that have curbed the coronavirus in the state of Connecticut. The students, faculty, and staff are excited to host Honorable Governor Ned Lamont to our college. Thank you.
President Dresner and Will, thank you both so much for hosting us here today, and good morning, everyone. Thank you so much for being here, as today we have the opportunity to lay out our historic vision to continue Connecticut's comeback. Over the past year, we've worked very hard to defeat the spread of the coronavirus, and we have become a model nationwide of not just testing, but also for our vaccination infrastructure, and we are so proud to be the second best state in the country for getting vaccinations into people's arms. It's time for us now to lead the country again in our efforts to build back better and to lead on addressing issues of equity in our state. Connecticut can only succeed if we invest in our future, and so that means investing in our transportation infrastructure. It means expanding broadband access. It means supporting early childhood education needs and enhancing and improving K through 12 education. It means addressing the mental health impacts of COVID-19. It means restoring and growing jobs and rebuilding our economy. It means creating a more affordable state and modernizing and making our data systems more efficient. We can do all of that thanks to the federal funding that is coming from the American Rescue Plan. I want to give a special shout out to our incredible congressional delegation for working so tirelessly to pass this legislation that puts money in people's pockets, gets shots into people's arms, and will help our economy get moving and growing again, all while lifting up our families. So it's now my honor to introduce our incredible governor, Ned Lamont, who's going to lay out his bold vision. Governor Lamont.
Well, good morning, everybody. And Lisa, it's great to be back at Naugatuck Community. About 2 years ago, we launched the Workforce Council right here in this room. And about a year ago, we were hit. It was the worst of the pandemic here in the state of Connecticut. We had our highest hospitalizations and our highest fatalities. And what a year it has been. And this is our opportunity to come back. And the American Rescue Plan gives us an opportunity to come back. And our amazing congressional delegation that Susan referenced gives us that opportunity. And we have $6 billion that we wanted to make sure is not just money, but it's investments that make a difference in people's lives, especially those that were hardest hit by this pandemic, and investments that allow our state to move forward with growth and opportunity for all. So Susan and myself and Josh and Paul and Melissa have been working with our commissioners trying to lay out an investment strategy that makes the most difference for those who are hit the hardest. So we're going to talk it through with you today, really led by most amazing commissioners any governor could ever ask for and the people of Connecticut could ever ask for. I think, first of all, about the kids and the very youngest. And we know what it meant a year ago when we had to have our nurses back and had to have our hospitals going. We didn't have child care. We didn't have daycare. And Beth Bye, our amazing commissioner, Office of Early Childhoods, could talk a little bit about what we're going to do for the earliest, youngest, the toddlers, and the biggest expansion of child care this state has ever known, and how important that is to give kids the very best opportunity before they get to school, and that allows some moms to get back to the workforce. You know, women have been disproportionately hit when it comes to who lost their job. And we're going to make sure they get their opportunity to come back. And Vanessa Durante's Department of Children and Families, DCF, you know, those kids, those foster kids, when we were there with Vice President Kamala Harris, what was that, a few weeks ago, and just saying, those DCF kids, they're often 1, 2, 3, 4, 5, very earliest that poverty creates a situation where they have to go into foster care. And Vanessa can talk a little bit about what we can do following on Beth's efforts to make sure those kids at the earliest stages of life get the very best opportunity. And next in the batting order is Charlene Russell Tucker. She has hit the ground running, picking up where Miguel left off as our acting commissioner of education. And she knows, I want to brag on these folks. I mean, our teachers, we were more likely to have our schools open starting in September for in-person learning than just about any state in the country. And what a difference that made if you were able to get to school and if you were able to get there on a regular basis. But we have something like 100,000 kids who have not been in school for going on 8, 9, 10 months a year. And we've got to do everything we can to help them get back in the game. And that means more than just STEM and Zoom and 3 R's. It also means just getting back together with their friends and mentors and learning in a whole new way. So Charlene's going to be here to talk about our summer learning camps, which are going to be opening up over the course of, the first or second week in July for 6 weeks, and how that paves the way for school in the fall. I want them ready to learn, ready to take full advantage of what we're trying to do there. But it takes more than about getting to school. It also has to look at the whole kid. And we've learned over the course of this last year the incredible stress that COVID has put upon our families, our children, and their parents. And Miriam Delphin-Rittman, our amazing Department of Mental Health and Addiction Services, was going to talk a little bit about how we're using the rescue plan money to expand mental health and services for our kids, working with our schools, working with our cities, and more broadly, what we can do for across the board in terms of recovery services. If we're going to get back, we're going to heal, we have to let people heal in terms of their physical health and as well as their mental health. And next up, talking about physical health, is Deirdre Gifford. She's been our Generalissimo leading the battle against COVID. And I think pretty darn well. You know, we closed down when we had to close down. We've been reopening safely going back since May 20th, leading the charge when it came to testing and leading the charge when it comes to vaccinations. And fortunately, given the rescue plan money, we've got a little more support there to make sure you don't let your guard down. And we beat COVID, we beat it back, and we do that led by public health. And we only open safely as long as we can open safely. Deirdre will talk about how those resources can make a difference there. And batting ninth, but you know, really the lead is David Lehman in terms of economic opportunity. We were turning the state around before COVID. We had thousands of you know, businesses looking at the state, and then things took a pause. They're now beginning to pick up again. But as David Lehman knows, our head of community economic development, economic growth and opportunity only work if they work for everybody. So he'll be here to talk a little bit about what we're going to be doing to help keep people get back in the game and help young people get a job. And one of the things that means, Lisa, is what we're going to be working on with the community colleges and having an apprenticeship program that is paid for out of the rescue funds. And we're working with our business community to make sure that we create 16, 18, 24-week certificate programs that have almost a guaranteed job on the back end of that. Be able to provide that at no cost to those students. And thanks to Beth By, also be able to provide free child care for people that need it, so they'll be able to get back. And then David's going to go on and talk about the investment fund that's been created. You know, a couple $100 million. Half of that devoted to our most distressed towns and communities. Half that devoted to people who are black and brown and maybe never would have otherwise had that opportunity to start up a business, which is a building block for their families and a building block for their communities. I hope what you hear today is that we have a plan in place that's going to make sure this money makes a lasting difference for the people hardest hit by COVID, makes a lasting difference for their communities, those communities hardest hit by COVID. It makes a lasting difference for the state of Connecticut as we get our economy moving again and moving on behalf of everybody. With that, it's my great honor to introduce to you Beth By.
Thank you so much, Governor. Great to be here with you and the Lieutenant Governor today. Governor Lamont challenged the commissioners behind me and I to develop transformative proposals that will help families recover from the impact of COVID-19 and lead to positive long-term improvements for our state. As the governor referenced, when Vice President Harris was in Connecticut to talk about child poverty and child care, the governor, Commissioner Durantes, and I shared information with her about the very high rate of poverty among families with young children, and that the highest number of referrals to DCF are from families with young children, and this is often tied to poverty. At the same time, Commissioner Gifford urged us commissioners to focus on reducing health disparities before they start as we considered strategies. And Commissioner Russell Tucker knows that high-quality early experiences help reduce educational inequities before they start, and also help children arrive socially, emotionally, and educationally ready to learn. Early investments have a very high rate of return. Supporting children and families from the start makes for a more equitable Connecticut and improves the quality of life for all of us. Two areas in the plan that address equity and the impact of the pandemic are child care and home visiting. Governor Lamont has spoken so much and so well about child care and how important it is, and he's talked a lot about the investments we're making. $220 million to make early childhood education more affordable for families, to improve the quality for all children, and help sustain our child care infrastructure. He's also proposed funds that will make free summer enrichment learning for children who missed out on preschool this year because of COVID. The child care industry and families have suffered during COVID. These efforts will help. And then a new initiative that will be really cross-agency. Will be working closely with DSS, DCF, DPH, and the Office of Early Childhood. The administration has developed a plan to expand home visiting to all Connecticut families. Starting in the regions hardest hit by COVID, families will receive 1 to 3 home visits in a baby's first 12 weeks of life. Home visitors will check on the mother's health and the baby's health and connect families to resources, and as needed, to community health workers that Commissioner Gifford's going to talk about. Connecticut has significant inequities when it comes to maternal health, birth outcomes, and perinatal health, and home visiting programs have been shown to prevent later interventions. For example, families that participate in home visiting have a 44% lower rate of referral to child welfare agencies, and emergency room visits are cut in half. These early investments will have an impact now for recovery, but will pay off in the long run for Connecticut's families and children, and indeed for Connecticut's budget. Connecticut will be stronger, safer, and healthier. And I'm really pleased to turn the mic over to my colleague, Commissioner Durantes.
Thank you so much. Thank you, Governor. Thank you to my partners in government. I am so excited today to be able to stand here on behalf of Connecticut's children and family and lift up the vision of this valiant leader. The governor has led us strong through this imperfect storm of COVID. The pandemic, economic devastation, and racial unrest have really torn apart what we knew to be normal. The way to bring this back is to follow what we've been talking about today, and that is through this plan that is carefully crafted to put children, families, and communities first. Connecticut investing in its next generation, or its next ups, really allows for parents' potential to be built up. Their academic capacity, their skill building, their living wages, the ways that we all recognize strengthen families and build up communities. This governor has put forth a plan that allows for Connecticut's children to thrive. They are smart, they are beautiful, they are resilient, regardless of their zip code, regardless of their skin color, regardless of their special or unique abilities. Connecticut's children will be our next generation, and so investing in them today through this plan will make sure that Connecticut thrives into the future. As we talked about the Vice President's visit, we shared with her that the administration's focus on lifting half of America's children out of poverty really has the ripple effect on several other industries. So, for instance, child welfare. Here in Connecticut, 58% of the children entering care are between the ages of 0 and 5. 58%, and most of those reports come labeled as neglect, which we know are mass poverty impacts. So this plan allows us to pay attention to that. This plan allows us to think about the lifespan of children. This plan allows us to recognize that prevention strategies, that we partner with our community partners and our nonprofits who will be delivering interventions across the lifespan, allow to strengthen children, build up their parents, and build up communities. So we are excited at the Department of Children and Families to link arms with all of our sister and brother commissioners here and to support this governor as his plan is unfolded over the next coming weeks to allow for a better Connecticut, a stronger Connecticut, one that the generation of children that are watching us today know that we are rooting for them and we are building a place for them to call home in a safe, and reliable way. Thank you, Governor, and thank you to all of you.
Thank you, Commissioner, Governor, Lieutenant Governor, and I am so thrilled and also excited to join this team to talk about our students and their return to learning and what we do for them during the summer. We continue to do a shout out for educators, for schools, and our families, for students who are having access to in-person learning, which is so critically important. Under this leadership and support of all our commissioners, we're looking to make sure during the summer we can re-engage our students, connect them with their peers, and access social, emotional, and mental health services, and prepare them for a successful fall. How are we doing that? By pooling our resources to look at initiatives like scholarships to support families who might not otherwise have access to summer camps, and also investing in our college students by recruiting them to be mentors to our children working in our camps and gaining meaningful experience, and also supporting our staff. Additionally, working with museums, libraries, and cultural centers to provide free and reduced price admission to various Connecticut attractions. How about for our teenagers to make sure that they have fun, safe, and healing spaces that they can thrive in for the summer? And also investing in services to support youth employment and internships, and also working with our colleges, we're here today, and our universities. With our students, we'll have unprecedented access to take courses and earn college credits. Finally, we're launching expansion and innovation grant programs to support the delivery of innovative, high-quality, financially accessible summer enrichment opportunities for our children and our families. All of these programs and experiences will promote renewal, address the opportunity gaps, and accelerate learning this summer. We want to make this a summer of learning and fun every day, everywhere, where our students can be happy, healthy, and ready to learn come the fall and moving forward. Thank you very much. Turning to my other commissioner.
Good morning, and thank you, Governor, Lieutenant Governor, my fellow commissioners, and state partners. It's such a pleasure to be here and to be able to be part of this announcement. We know that COVID has had a significant impact on mental health the past year, and the past year has been quite stressful. We've seen an increased demand for services, and so I'm pleased to be able to be here today to talk about a visionary plan that invests over $10 million in adult mental health system and strengthens our safety net to ensure continued uninterrupted services to those in need. We, and I include all of our community private nonprofit partners, have been through a challenging year. Providers across the DEMA system of care have stayed open throughout the pandemic and have risen to this unprecedented challenge. The innovations we're looking to implement will help to create a stronger, more resilient Connecticut that will be healthier today and in the future. The proposed initiatives expand access to crisis and further funds community services for those with severe mental illness and substance use disorders, while focusing on eliminating disparities and promoting equity. Increased access to mobile crisis services will allow for immediate crisis response, ensuring that people get the support that they need in the moment that they need it. These funds will also support 2 regional crisis stabilization centers where individuals experiencing mental health crisis can be treated in the community without inpatient hospitalization. And for individuals receiving care in an emergency department for mental health challenges, we're looking to fund recovery support specialists to provide support there in the emergency department and beyond. 2 of the biggest barriers for those seeking help are stigma around mental health and knowing where to go for help. With this in mind, the ARPA dollars will be used to help to continue to spread the word that treatment is available, that recovery is possible, to amplify messages about Connecticut's wealth of resources in terms of mental health, addiction, and wellness services and supports. All of the proposed investments are aimed at helping to uplift those who are most vulnerable. Our aim is to expand services to those in need, when they need it, without barriers, and in the most appropriate settings. Thank you. And now I'm going to turn the floor over to Commissioner Gifford.
Thank you very much, Governor Lamont, Lieutenant Governor Bysowitz. Good morning. Governor Lamont's ARPA public health program takes the lessons that we've learned from COVID and turns those lessons into opportunities to build a safer, healthier, stronger, and more equitable Connecticut. What are some of those lessons? First of all, as we've heard this morning, we were not all equally at risk from COVID. People of color were more likely to get sick and die. People in poverty had worse outcomes, and people with chronic disease or obesity were at higher risk. We also learned that government services are essential for people in their time of need, but we can do a better job of coordinating those services. It can be too hard and too time-consuming for people at a time of crisis to have access to the services that they need from so many different agencies and in so many different ways. So how are we taking these lessons and turning them into opportunities? First of all, we will finish the job on COVID. We will continue our vaccine program and continue to provide testing in our hardest hit communities. We will make investments in our local health departments and invest in the Department of Public Health to make a long-term focus on health equity. And I'm proud and delighted to say that we will continue the historic investments in young children by investing in community health workers that will assist children and families that are struggling. In a follow-up to the Universal Home Visiting Program that you heard Commissioner Bai describe, we will have 100 community health workers that can serve up to 3,000 families with young children every year. These community health workers will be of the community and the culture in which they serve, and this program will go to the roots of health disparities and can have effects that can last a lifetime. Some studies have shown that every dollar we invest in community health workers can save up to $2 in services later in life. And finally, we will redouble our efforts, as you're seeing here this morning, to work across agencies to make our services better. We will build a digital one-stop so that people receiving human services can access the benefits they need, get answers to their questions, and get the help that they are asking for in one easy place, no matter what the agency, so they can spend time focusing on their children and families rather than navigating complex agency structures. These are once-in-a-generation investments in public health and in young children, and they will make Connecticut a place where every family can thrive now and into the future. Thank you. And now I'll introduce Commissioner David LEHMAN.
Thank you, General Gifford. Generalissimo, I like that. Governor, Lieutenant Governor, and it is great to be here with the full team. We've worked so closely for more than the past year, but it's great to be here and at this point, where, as the Governor mentioned, we now will be focusing on transformational investments to help Connecticut this summer and beyond for the next generation and hopefully generations to come. Where I want to start is, in addition, the Governor and the team announced a significant investment in workforce yesterday of over $103 million, in addition to $40 million already in the Governor's budget, to focus on workforce, to focus on programs around certificates, incumbent worker training, where we can have a real impact to Connecticut in providing those job opportunities. But when we think about economic development and where we're going to come with the additional investments here, there's really three main aspects that we're focused on. One is growing opportunities for everyone in Connecticut for the jobs of tomorrow. Secondly, we want to make critical investments that enable innovation, entrepreneurship, and business formation in the state of Connecticut. And third, we want to further invest in the livability and vibrancy of our big cities, but as well our small towns. All told, we think the initiative in the Governor's Economic Action Plan as part of our ARPA will create or retain over 80,000 jobs in the state of Connecticut over the next 5 years. Let me go through a few of the initiatives. As the Governor mentioned, first and foremost, there is going to be a heavy focus on small business support. $150 million will be there to provide incremental equity investments, lending, as well as grants to small business. And we're not going to stop just there. There's going to be technical assistance and other aspects to assist business owners and entrepreneurs to make sure their businesses can start in Connecticut, but also thrive in Connecticut. At least 50% of those funds will be focused on women, minority, disabled and veteran-owned businesses in the state of Connecticut. And again, this is going to be an investment fund. There's various different aspects of this, but this will be a real program very, very targeted at small businesses. And that's where the job creation is, but in the communities and those that are most in need and where we think we can really move the needle. Second, we're going to focus on innovation. There will be an initiative focused on what we're calling Innovation Corridor, which is up to $150 million to support transformational placemaking projects, really focused on driving, again, job opportunity, innovation, and business formation in our cities in particular. We think that $150 million of state money can be leveraged by up to $500 million of private sector capital. In addition, there'll be a heavy equity aspect of this in terms of job opportunities in all of these projects. Should they proceed, we'll have community benefits agreements to make sure there's a full engagement with the host municipality. Thirdly, the Connecticut Communities Challenge, a $100 million competitive grant program to spur investment on high-quality transit-connected development projects. These are projects that are going to demonstrate, among other things, improving livability and the appeal of communities and provide greater employment opportunities for everyone. In addition here, similar to a lot of other philosophies from Governor Lamont, there will be a private sector match that is going to be required. We want to make sure the state's making these investments, but we want to make sure the community and the private sector come along with us. And again, heavy emphasis on equity and community benefits in all of these areas where the state's going to make these physical investments. There are many other initiatives as the full plan is going to be rolled out, for example, focused on green technology, renewable energy, and investing in sustainable entrepreneurs and businesses in Connecticut, as well as a continued focus, I should say, on licensing and making sure that we're modernizing regulation. Commissioner Gifford referenced a citizen resident one-stop, I should say, as well as the business one-stop. We want to keep making sure it's easy to get a job and take advantage of the opportunities in the state of Connecticut, and that's really going to be important. So very, very thrilled to mention and announce some of this today. We think there's a lot of really great opportunities here for the state of Connecticut to truly, as the governor said, move the needle for generations to come. So with that, I have the privilege of announcing the Secretary of OPM. Actually, the governor. Let me introduce her. The governor is going to be doing that. I rescind that comment.
Supreme Allied Commander Melissa McCaw. Let me just tell you what a tough job she's had at OPM and why it's so important. I mean, at the same time she's putting together our $22 billion operating budget, we also have $6 billion in the rescue plan money. And she's put this together as an overall package that makes sure we take care of those who have been hardest hit by COVID and can make the most enormous difference, putting in place a balance between the 2- and 3-year money we get from the rescue alongside our budget. I think she's done it well. She's had a lot of competing interests. She's able to take care of nursing homes, working with not-for-profits, working museums, taking care of a broad group through this combined package. Melissa, over to you.
Thank you, Governor, and thank you, Lieutenant Governor. Governor, thank you for that very warm introduction, but you are indeed our Commander-in-Chief, and we're so very thankful to be here today. I believe that your cabinet stands beside you, very proud of the vision that you set forth for the state of Connecticut, and that was a vision you asked us to be transformative in making a strong comeback. I am so thankful today to share with you some of the financial tenets of the governor's plan. And as the governor's cabinet has shared with you, the approach we took was the approach through the lens of how the pandemic has impacted real people's lives, from the young infant all the way up to the most senior of our society. Connecticut has received over $6 billion in funds from the federal government to support our recovery, and more than $3 billion is directly coming to the state to help to redirect for recovery, with portions going to your cities and towns as well as to your school department districts. And as our commissioners indicated, there are key themes that the governor is including in his vision. 1, defeating COVID. You heard from General Gifford about addressing the public health impacts of families, continuing our robust testing program, providing community support workers on the ground, hearing directly from our residents about what their needs are. We heard from Commissioner Lamont about investing in our future through infrastructure investments, small business supports and startups, significant resources for minority business entrepreneurs, as well as women-owned businesses, supporting the recovery of private providers who have been on the front line serving vulnerable populations. The governor has included resources to support recovery, and also those who have been impacted by the criminal justice system. Resources are included in this plan. The third component is creating a more affordable Connecticut, and you heard from Commissioner Bai about families that need access to childcare. That childcare should not be an impediment to ensuring that your kids have a strong enrichment program or have the ability for a parent to return to the workforce. And you heard from Commissioner Russell Tucker, who has hit the ground running leaps and bounds, and she has set forth a vision with the governor about supporting our kids in a strong recovery coming out of hybrid or partial reopening of our schools. We have also included supports for children that might have students who might not be able to return and need additional scholarships. The governor is doubling his commitment to the PACT program that would support additional last dollar emergency financial aid resources. Resources are in here to support the mental health impacts of COVID. And then there's economic growth, and that has to be growth that works for all, for every segment of our population, no matter what you look like, no matter your walk of life, no matter your color. And Governor has set a vision. You heard from Commissioner Lamont about our significant investment in restoring jobs and rebuilding our economy. And finally, we've learned through COVID that there is a critical need to modernize our public health and human services infrastructure, and how the average Joe or the average Melissa interacts with government and accessing benefits when they need them. And so the plan here today is a transformative one. It represents more than $3 billion of braided investments. We are calling upon our partners at the local level to match this vision, whether it's matching a summer camp program, whether it's matching in the area of workforce development or job creation or economic development, and to stretch these dollars to be as impactful as they can across the state of Connecticut. And finally, I want to close with reminding you that equity is at the very heart of the governor's vision for the strategic investments of ARPA. Every dollar and every initiative has been designed with equity at its core, whether it's expanding home visiting, whether it's making sure that everyone has access to broadband to ensure they can access telehealth or education, support to small businesses. Equity is at the very heart of the vision, because all people should be able to access the services or the programs that they need to be successful. And that is what is key to ensure that we have a transformative recovery for the state of Connecticut. With that, we conclude the governor's presentation, and we welcome any questions you might have.
So what's the plan? Where do we go from you? You're out here today broadly outlining, I guess, your strategies and your priorities and the thinking that went into this plan. But when are we actually going to see the actual plan?
So you may recall that the legislature did pass a bill recently that requires the governor to submit a proposed allocation plan by Monday, April 26th. This is a preview of the major areas of investment, and the plan will be released on Monday.
And we're talking, is it 2.7 billion coming from the American Rescue Plan, and the other is from the other portion of the $6 billion is from the earlier federal stimulus?
So the American Rescue Plan Act has several sources of funds. The one that you are referring to, the $2.6 billion, is the State Fiscal Recovery Relief Fund. Those dollars are the most discretionary, if you will, that will come directly to the state of Connecticut. But there's well over $1 billion in educational funding that will be going to our districts, a portion that stays with the Department of Education. There's a $141 million capital project fund, as well as over $1.6 billion that will go to our local municipalities. Our plan, the governor's plan that will be released on Monday, will focus in on the $2.6 billion, as well as some of the other braided funding sources.
And how is the availability, because I believe the budget assumed $1.75 billion in federal money. So how is the additional allocation going to affect the administration's budget planning or approach to these upcoming budget talks?
The governor's plan for the use of the $2.6 billion fully aligns with his proposed budget. It includes $1.75 billion to support balancing the budget over the biennium.
Well, I guess what I'm getting at is you're going to get some more federal money, more than you assumed that was in the budget plan that you submitted. So do you have a little more room to operate? Are you going to be spending extra? Are you going to be using this money to supplement or replace state dollars that you had in the budget?
Very simply, we are going to use $1.75 billion to balance the budget. There's about $900 million remaining that will support the programs that you heard the governor's cabinet speak to today, as well as a number of other funding sources that were in the ARPA plan that we're braiding together various funding sources. So yes, we'll fully be able to meet the assumptions in the governor's budget plan and make these transformative investments.
Can you speak more on the additional guidance from the federal government about how these dollars should be spent, what that timeline looks like?
Great question. We have not received additional guidance yet from Treasury. The bill does allow for revenue replacement. It does indicate that the funds need to be used to support public health related expenditures as it relates to the pandemic or recovering for the pandemic, the negative impacts thereof. So we do have limited guidance. We've obviously taken that into consideration for all of the initiatives that you heard the governor's cabinet speak about. And if as additional guidance comes in, if there's a need to modify the plan, we will work with the legislature to do so accordingly.
I want to ask more about getting women back to work in the state of Connecticut. You talked about the child care opportunities that will be coming forward. Can you talk more just about job training, maybe some opportunities that they haven't been able to get during this time, and any other resources that will be put toward getting women back to work?
Yes. To the workforce, the governor's committed $50 million to support child care for people in workforce development, and also $26 million to help families who sort of just missed being able to get affordable child care. So now they can get the child care subsidy. Those are big barriers for women who are making choices about, is it worth it for me to go back to work? I think that $26 million investment in expanding who can have access to child care subsidies is going to make a really big difference for middle class families.
And how is that being expanded? Are you changing the income limits, or?
Yes, exactly. So right now, families that live below 50% of the state median income, so for a family of four, that's in the high 50s, $59,000 a year. Now we're going up to 65% of the state median income, so for a family of four, that gets closer to approaching $70,000 a year.
Do you have any estimates, ballpark, on how many more families will be able to qualify?
It's more than 3,000 families, given the funding and the dollars. It's well over 3,000 families will qualify, and it's more than that in terms of workforce, because that's a $50 million investment.
Governor, kind of an off-topic question. With people being vaccinated, are there plans anytime soon to lift Connecticut's mask mandate or changes in general to the mandate?
Probably outside, yes. Inside, no. I think I've got to talk to Deirdre, but it does seem to me that inside it's safer to keep the mask mandate a little bit longer. David Lamont has talked to restaurateurs and stores whether they want the discretion to decide and they said, let's keep it simple, let's keep it clean, let's keep people wearing a mask when they're in close quarters inside a little bit longer.
Governor, this morning, Senator Fonfara basically challenged you to back up the D in behind your, I guess, political designation in response to some of your comments yesterday concerning the tax package, the Democratic tax package and spending plans that the Democrats in the legislature have put out. One, I just wanted to give you an opportunity to respond to that comment. He seems to be questioning your standing as a Democrat.
I think we've responded over the last 45 minutes, Paul. I think you see one of the greatest investments we can make in kids, in people, in child care that this state has ever seen. And you can fuss about state versus federal money. The point is, over the next 2 or 3 years, it's going to be transformative, in particular for the people who have been hit hardest by COVID. And I'm really proud of what this team has put together.
Well, is it all that unusual for the Democrats in the legislature and the Democratic governor to butt heads at the beginning of a budget deliberations, or maybe not butt heads, but be in different places? Everybody puts out their position where they want to start from, and then we negotiate from here. I mean, we've kind of seen this.
I think that's sort of the way they've been doing it here in Hartford for about 100 years, yeah.
And the CBIA came out today, unsurprisingly. They're not crazy about the tax package either. Small businesses will bear the brunt of many of these tax increases, and it defies sensible logic that there are lawmakers who think further burdening struggling smaller employers is a positive for the state. That's the same illogical thinking that caused Connecticut to be near the bottom of the nation's recovery from the 2008-2009 recession. Those who do not learn from history are doomed to repeat it. Do you share that sentiment? What do you think about that?
I think it's pretty negative. I mean, we are doing so much better as a state over the last 2 or 3 years compared to those statistics. Much better in terms of job creation than we were before. Much better in terms of new business startups than we were before. More job listings in April than we've had at any time in the last 10 years. But you're right. I think small business needs some fiscal stability. They like an idea of what's going on. They don't like a lot of the increases, even being floated as trial balloons. And our budget does a lot for small business. David mentioned a lot of the investment opportunities we have there, the training we're providing for small business, what we're doing to bring down the high cost of health care. As a small business guy, I can tell you that hammers small business. We're going to make it much more affordable for small businesses to grow and expand here in the state.
And a common refrain or complaint from the Republican side in both the Appropriations and Finance Revenue Bonding Committees is that they were shut out of the deliberations, that Democrats did not bring them into the talks. How will you be proceeding in your budget negotiations with the legislative leadership?
Same way I have for the last 2.5 years. I got an open door, big table. We talked to the legislative leadership on both sides of the aisle. Leadership on both sides of the aisle, we got together just a couple weeks ago, walked through the executive orders. Now Nora's walking through the executive orders with both sides of the aisle. We'll be getting together again next week to walk through what we hope to do here with this American Rescue Plan money, and hope we can work together on it.
And have you heard anything? I mean, you issued, you submitted new declarations just earlier this week, I believe. Have you heard anything about any of the two select committees meeting? Have you been advised that either select committee required under the two statutes will be meeting to either nullify or not your latest declaration?
What we've done is we've narrowed down the number of executive orders from 300 to about 70, very specific to public health, very specific to things we need to do to make sure the vaccination program is successful. And now we're working through with the legislators to make sure that that gets ratified and gives us the opportunity to continue it past May 20th.
Governor, can you speak just more on the historical context and perspective of these federal dollars? I mean, this is investment money that members of your commission here would only dream of in their term. Just the overall impact of this amount of money coming here to our state.
I think that's a really good question. Look, for the last 25 years, all of us in government, do more with less, cut, and here's an opportunity. I come out of the business world where you have some investment capital. And for those of us now in the public sector, an opportunity to invest and make a difference. And as I've told my team, I want to make sure at the end of year 3, we're proud of the investments we made. We can point to a difference we made in people's lives. I don't want anybody saying, what happened to the money? One last question?
Yes, Governor. This is from Jody Latino News 8. You have flavor vapes in your budget, but the legislative Democrats don't have it in theirs. Will you make the final push to have it in the final package?
What was it?
Flavor vapes, is that
There'll be a flavor vapes.
vapes?
Yeah. There were two?
Yeah. You want me to repeat it? You'd like me to repeat it?
Are we doing flavored vapes?
The governor feels, and his team feel strongly from a policy perspective. We know that the flavored vapes result in increased use, particularly by our young people, and it's a policy matter that we seek to continue to have discussions with the legislature, and our position has not changed. Thank you.
Thanks, everybody. Appreciate it.